We are going to be looking at surgical prep this week. So we've got the name of instrument or tool on the left-hand side, and then on the right we want to know what it's used for, what key characteristics there are of that instrument, and then components of the instrument. We also have some awesome links for you about preparing the surgical site and scrubbing your patients and prepping them for surgery. So we're going to go ahead and take a look at our Quizlet. And the first thing we're going to look at is an Ambu bag. Many of you have seen this in the human medical shows where that Ambu bag is used to help in respiration. So the appearance of an Ambu bag is going to be a bent plastic tube attached to a rubber bag or pouch with a flexible extension tube at the distal end. The use of this is going to be a type of bag, a valve mask used for assisting respirations and increasing oxygenation. So here we have Ambu bags, and we do use these in animal medicine as well. So if our animal is going into cardiac arrest and we need to provide CPR, this is something we can utilize. If we're able to get an endotracheal tube in, as well as an animal that we have to provide manual pumps for if we're not able to use a machine for that. Next thing we're going to look at is a backhouse towel clamp. So the backhouse towel clamp is a forceps with a pincer-like jaw, and it's used for securing drapes or towels to the actual animal. So here we have the pincers. They come in various sizes and lengths, but we are just going to use this to adhere. It does pinch, but the animal is going to be anesthetized and is not going to feel that, so it will just secure that drape to that area. Next we have our syringe. So we've talked about our syringe quite a bit. It's our tube with a plunger. We can use this for medication, fluid administration via injection or oral. It also may be used to administer lavage fluids or to aspirate an airway. We can also use the syringes to inflate or deflate our endotracheal tube cuffs. And so here's just a basic luer lock syringe. Next, we have our IV administration set. So an intravenous administration set is going to be a full kit and caboodle. So it's going to be a pliable tube with a tip connector on one end to be placed into the fluid bag and a screw cap at the other with a shutout valve in the middle. The use is, this is a device used to administer fluids or medication from a container to a patient's system through a needle or catheter inserted into a vein or subcutaneously. So this is that intravenous administration set. So here we have this long piece is going to go into the actual fluid bag or the medication, because we can also give medications through this as well. And then so that's the part that goes into the bag. This has a cap on it, but otherwise it is sharp, pointy with some holes, and that's going to pierce the end of the bag. And then here we have the clamp. So this is going to turn the tube on or off, so it'll occlude the tube if we want to stop, and then it will release the tube if we want the fluids to go through. Here we have this blue end is the piece that will screw onto our catheter port if we have one inserted, or we can put a needle on that end. So that is that luer lock tip right there, so it can secure into a needle. This also has another port right here if we want to. We can also insert medications into this port. So if we have a fluid line, then we need to give medications, we can do so in that port and still maintain our flow of fluids. So that is your IV administration set. Next, we have our catheter, our intravenous catheter. You've heard us talk about catheters quite a bit, so this is specific for intravenous use. So this is a firm plastic tube or cannula connected to a hub, which is the steel needle allows for the placement, but that needle is going to be removed upon insertion. This tube allows the venous access for long-term medication and or fluid administration. So here we have, this is all in one. So this is the needle portion, but there is actually a very thin piece of rubber that you can't see around that. So the needle goes in, and then that rubber is there as well. Once we thread that catheter in, we'll get a flash of blood in that catheter tip, and then we know that we've hit our port, and we'll go ahead and release the needle, but then pull the tape the rest of the catheter in. Next, we have our butterfly catheter. So butterfly catheter is going to be that same concept, except this is going to be a small with a plastic set of wings with attached tubing. So those wings will make it a little bit easier for you to grasp in place. These are for short-term uses for administering medication intravenously. We can also draw blood with butterfly catheters, so this is commonly used with our cats in that medial saphenous vein. So this does not have that rubber tube, it is just that needle, so this is why we don't want it to be inside for an extended period of time, but we do still have that connecting port if we want to place a syringe with medication or syringe to draw blood. Next, we have our small animal oxygen cage. So we will have cages that do administer oxygen for those animals that are underneath respiratory distress. So these are enclosures with solid walls on all of the sides and a door that's made up of plexiglass with a small plexiglass door opening in the denture in the center in the center of it. This is used for airtight enclosure that allows for that oxygen treatment. So here we have standard oxygen tank. So both of these up and down are oxygenated. There is your sodium bicarbonate in here to clean out that carbon dioxide, and then you can insert a divider in these as well if you needed more cage bank accessibility. Next, we have our anesthetic machine. So anesthesia machines are very complex. There's lots of tubing, lots of housing, lots of little gadgets and gizmos and things that you have to be mindful of. So they do house a liquid anesthetic agent and then gaseous oxygen tubing. So the oxygen is what is the carrier gas, and it carries the anesthetic. And the tubes will be connected for breathing reservoir bag and two-way flow for exhaling patients. Machines are used to carry that oxygen and anesthetic agent. We can also just use them for oxygen flow for those patients that are in severe oxygen distress. So here we have a portable unit. We have our vaporizer right here. So right here is where our anesthetic fluid goes, and then it becomes gaseous and carries in through the oxygen. This is your oxygen flow meter. And then here's your tubing that goes into your patient's endotracheal tube, and then that reservoir bag. So this is where we can count those respirations. This is very similar to that Ambu bag, but it is not a standalone, right? It's connected to your machine. Next, we have a snook ovarysterectomy hook. So a snook hook is a metal tool with a hook on the end that is going to be used to retrieve the uterine horns when performing an ovarysterectomy. So here we have a snook hook, and we can use this for other things as well, but that's what it is designed for. Next, we have our surgical drapes, and our drapes are tightly woven fabric, various sizes. They can come in different colors as well, so they are sterile fabric or fabric-like material used to isolate the surgical site from the rest of the body. Now, they are sterilized in the clinic, so we sterilize them, and then we use them to drape over the patient. So these will go in the autoclave, and that way we know that they are sterile. And that is our surgical prep.